Is a bulging disc ruining your life right now? Hey there, I'm Dr. Greg Barnes with Triangle Health Center, and today we're going to be talking about leg pain, sciatica, persistent back pain, bulging discs, arthritis in your spine. And is that process affecting your quality of life? Is it affecting your sleep? Do you have a hard time playing with your kids or your grandkids? And today we're going to be talking about how a bulging disc or nerve pressure can cause those problems. So many people, we sit for a living, we've had a lot of repetitive motions with our jobs, and unfortunately, because we live in America, the typical approach to problems like that are to go to a traditional doctor where we get medications, maybe injections, or maybe your only option you're left with is surgery. Well, the reality is that there are many options that are available today that can help people avoid having to use those types of methods. And so if you're the type of person that loves getting to the root cause of why you have problems with your health or why you have pain, then you're going to want to watch this video. So what we have right here in our office is that Ashley is actually doing spinal decompression. Now, spinal decompression has been around for many decades, and it is the top non-surgical approach for people that have bulging discs, arthritis, or even sciatica going on in their leg pain. So what she's doing right now, of course, she's laying there. So from a standpoint of treatment process, it's pretty relaxing because you get to lay there and relax. And what this is doing is it's pulling, and right now we're pulling her at a maximum of about 50 pounds. Now, some people will pull at 80 pounds or 100 pounds, depending upon how bad their disc is and what their weight is, because the heavier the person is, we got to pull harder, with that. But what happens is that when you have a bulging disc that's putting pressure on a nerve that's going to your low back, into your hip, or down your leg, what this suction process does is that by pulling apart that vertebra or those bones there, it helps the disc actually get sucked back into place there. And in doing so, it helps get pressure off the nerves. Now, in addition to sucking it back into place, it allows nutrients to get into the disc, like vital nutrients that help the disc actually heal and in many cases be revitalized. Now, this treatment process is not a magic bullet, but if you are a really good candidate for this, it is an incredibly valuable tool at helping get to the root cause of your issues. And so what we are offering right now is we're offering a low-cost way for you to come in, try this out, and see if you're a good candidate for care. Now, there's no strings attached, right? There's obviously a lot of people out there these days that are doing bait and switch techniques, and it's okay. We all got to make a living. For this, though, for us, is we are looking for people who are committed to helping actually correct the cause of their problem as much as physically possible. And so, yes, if you do this, again, we offer a low cost, introductory price to try this out. Really just to make sure that our process is going to help you and not hurt you. But if you are a good candidate, and we'll talk about what that means, well, yeah, the process, this is not a quick fix, okay? Now, most people will get off this and they will feel better. Now, will they feel better forever? No, they're not. They might feel good for the rest of that day or maybe a few days. But to actually get to the root cause of this issue, we will do anywhere from 10 to maybe 30 visits of this, along with chiropractic adjustments, which we recommend in addition to that, because that helps us to speed up that process. And really what we find is that if you are a good candidate and you go through a protocol, you should see anywhere from 80 to 90% success rates and a dramatic reduction in your pain and radical improvement within your function and really your day-to-day life. So if you're the type of person that's looking for a quick fix, don't click on this ad. Just don't even waste your time or our time in coming in. But if you're like, I've never tried something like this before, and I want to see if I'm a good candidate, and if I am a good candidate, I'm the type of person that's willing to do whatever it takes to correct this problem and to take my health to the next level, then we are definitely the right office for you. Now, everybody always asks, well, what about insurance? Well, this process is not covered by insurance in our office or any offices for that matter. It is, a corrective and a wellness process. And so that is not typically covered by insurance. So this is an out-of-pocket procedure, but we make care very affordable in this office. For anybody that has been committed to getting to this root cause of their issue here. We've never had any issues with people being able to afford their care here in this office. So where there's a will, there's a way. And obviously everybody is different in what their needs are. So, we're not going to be able to tell you on the first day when you walk in here exactly what is going to, it's going to cost. But once we take a look at your x-rays or your MRIs or whatever you have, and we see here's what you need, we're going to put together a very logical care plan to help you get to your best ability, your best life possible. If we can't help you, we'll let you know. Or if we don't think that this is going to be the best bang for the buck for you, well, then we'll do everything in our power that we can to refer you to the right place to get your challenges, solved. So again, this is Dr. Greg Barnes, Triangle Health Center. We're at 1901 Northwest Cary Parkway. And if you made it this far in watching the video, hopefully you learned something. Hopefully you're inspired by this. We will do whatever it takes to, morally and ethically get you better and help you get you back to doing, the life that you deserve and the life that you want here. So again, if this process is ruining your life or affecting it in a way, we want to see if we can help you with that and help you have your best life possible. Have a great day, and we look forward to seeing you.